great. When we launched the Canadian Academy of Lifestyle Medicine coming up on 5 years ago, we realized we were way ahead of the curve, and certainly now that we're back to reorganize things, a lot of you picked up brochures up front. Please don't email me because I won't answer them. That email's dead. We're revamping the whole thing, but I just want you to keep that somewhere in your kitchen or tuck it in the drawer you hide your chocolate in or something like that, and then just hang on to it for a couple of months because we're going to get organized very soon. Anyway, I'm a full-time family doc. I'm happy to see that one of my colleagues, our nurse practitioner, Emma, has made the trip all the way here from Sauble Beach to take part in this day, and a medical student from Western who goes to Windsor campus is here as well. So Emily, thanks for coming. Emily's going to come up and watch me do lifestyle medicine up in Sauble Beach. So what got me started in this? And I'll go through that a bit in the slides, and a couple of the slides that I'm going to show you've already seen, because I think we all know the same evidence and we've all been kind of involved in this field for the same reasons. I, like Arjun, have gone through a huge lifestyle change, and I'll show you my picture. A lot of people, when they see me coming back and forth to London, every time I go back, they say, "What are you taking?" And I said, "What do you mean, what am I taking?" They said, "Every time you come back, you look younger." And I said, "It's called food." Because we've only become plant-based in the last 2 years. I'm the son of German immigrants. I've eaten more sausage than all you guys put together. And everybody in Sauble Beach knows that I am the butter tart king. I have driven 100 miles for a butter tart. I have also judged a butter tart competition. So even though I rarely eat them, it is my guilty pleasure. So, and I also want to put a shout out to Shane, because I'm like Shane in some respects. Not only was I middle of the pack family doc of Western, but I was the last student to get admitted into the class in 1979 because somebody had a psychotic break, and I was on the wait list, and I entered Western Medical School a full week after the class started. And so you guys are lucky to have me here, because I could still be a laboratory technologist. Anyway, it's been a wonderful career. I was London's first palliative care doc. I started a women's OB clinic in a tertiary care center. It was the first one in Canada. And I'm happy to say we're having our 25th anniversary there this year. So I've done a lot of interesting things. This is by far the most interesting thing I've done in my life. And I've told people at age 66, going on 67, I've got more to look forward to in the next probably 15 years if I'm lucky. My grandmother lived to be 105, so I'm hoping that now that I've changed my gene pattern, that I'll be around for a long time. So anyway, I don't have any disclosures to make for you. So I want to talk about a global burden of disease a little bit, and then why lifestyle medicine is so important. I've been a firm believer, and I've said this in public, that I think there's enough money in the healthcare system. The patients just have to learn how to use it less. And so if we can get patients to start to turn their health around, there's plenty of money in the system for all of us, and we won't need nearly as many of these $500 million hospitals that we're building all over the province. And I'm going to talk a bit about shared appointment model, because this is something I use heavily, and I'm going to use it even more heavily as we start to develop programs up at Sauble Beach. If any of you know, Sauble Beach is this lovely retirement community up on the shores of Lake Huron. My wife and I live 100 meters from the beach. So my wife's a marathon runner. She runs our dogs on the beach. The dogs go for a swim every night at the beach. I go for walks on the beach right now because I'm currently not running, but it's a lovely place, and we've got an amazing team of 12 of us that are in a blended salary model family health team. It's always important to remember that the social determinants of health are extremely important when we're trying to do lifestyle change. And the thing that I've realized more and more is something called ACE scores. And some of you have heard of these, some of you haven't. This is called an Adverse Childhood Experience Score. It is by far, I've found, the biggest sticking block why people don't change. If you learn how to give these 10 questions to patients, if they score 4 or more, then they're more likely to choose bad lifestyle choices for a long time and be more difficult to manage. So the Global Lifestyle Alliance describes lifestyle medicine as this, and I won't read it, you can read it yourself, but it's basically comprehensive lifestyle change. So even though today we're talking about plant-based eating, or whole food plant-based eating, it really is the whole package. So it really is exercise, it's mindfulness, social connectivity, and I've seen this firsthand, where not only are we preventing disease, but we're treating disease. I've been a family doc for a long time, and when you go to see your family doc, they say, oh, you know, we got to go through all these preventive health schemes. So put your hand up if your doc said you need a pap smear, a mammogram, an FOBT, we're updating your immunizations and so on, okay? Yeah, so it's everybody. None of those things are preventive. That's disease identification, okay? Nutrition is preventive healthcare, and I'm now completely changing every single patient that comes in, and I'm like, Arjun, I might see 20, 25 people a day. Even the person coming in for a 5-minute appointment on migraine headaches, I stop and take a food diary, because people need to know how to eat, and I work in Bruce County, where, trust me, they haven't known how to eat up there for a long time, and just like a lot of places in the country, there's too much alcohol, too much cigarettes, and this myth that we need to eat meat to be macho. The WHO has really been putting a lot of effort into this, because this has become a global epidemic. The Global Alliance, which is a spin-off organization from the American College of Lifestyle Medicine, is the only organization in the world that's been invited to Geneva, Switzerland to address the WHO. And so they are trying to connect with the WHO. This really is sensitive, isn't it, David? I have the same issues. But I think the interesting thing is I've used my lifestyle approach to medicine to basically look at all these issues. It must be on an automatic. But basically, patients that have any of these conditions, it's worthwhile having the lifestyle medicine chat with them. Because there are things, especially on the food side of things, that you can impact their life and the progression of their disease. I'm going to talk a bit about shared medical appointments at the end of my talk, because there are 6 conditions that the Ontario Health Ministry gives us a fee code for to engage patients in shared medical appointments and bill for it. And I only found it 3 years ago, so it just shows you how well it's buried at the back. So one of my teachers when I was at Western was Ian McQuinney, and he really was the godfather of family medicine. So this is a direct quote from Ian's book from 1997. And he's really talking about the importance of food and nutrition. The reason I put this up is not because it's accurate. It was found buried about on page 200 in the chapter under complementary and alternative therapy. And that's where you found the nutrition chapter, which was really 4 paragraphs. So knowing that 90% of my day is based on trying to pick up the pieces of people's poor nutritional choices, I think if we were to rewrite this book, and certainly the new lifestyle medicine textbooks that are coming out have nutrition as the #1 chapter. Oh, sorry, let me go back to the picture. That was the break at our national convention this year in Toronto, Ontario. And so the culture of doc, we are still the coffee and donut culture. Despite years of complaints from doctors rating the food at our national conventions, that's still what they think we deserve to eat after paying $900 for 3 days of conference time. In Ian's book, he goes on to say that Class A recommendations are that once a year at least, that patients are counseled on the adverse nutritional habits and moderate physical activity. I ran around the Bay a couple of years ago, which is a 30K race, and I came up on this guy who had actually had a heart attack doing the race before, had his, as you can see there, quadruple bypass and a stent, but managed to come back and run the race again next year. So I stopped to talk to him for a bit, and he said, I've become plant-based, so that's why I'm out here with 2 friends. And I actually ran the race with a guy who was 5 years older than me, and he kept phoning his wife, because he said, don't worry, honey, I'm running with a doctor. And after his 4th bathroom break for his BPH, I finally left him and just kept running. There are a few people in the audience that are old enough to remember the Lawn Report. Anybody remember this? Okay. 1974, our health minister came out with this wonderful idea to creating a white paper. And I would encourage you to read it. Go online and look at it. Because if we would have adopted the Lalonde Report as the basis of our healthcare system, we wouldn't be having this conference today. He was drawing attention to the fact that children were watching an hour of TV a day, and that was worrisome. And the only legislation we got out of this report was seatbelts. And the sad thing is this, in 1974 is the days before the internet, but the 3 Nordic countries got their hands on this report and adopted most of it. And they to this day have some of the best healthcare outcomes going. But this was a comment that he put right at the end of the report. And basically, this is his predictiveness, is that for the future, that the physicians of the future will basically be picking up, will be the catchment for the victims of treating the ills caused by environmental factors and behavioral risks. So, you know, no truer words were spoken even then. And then came along Monique Begin, the next, oh, sorry, before we get to that. Monique Begin was the health minister right after him, and I'll show you her comment 20 years later. But this is really the slide that we've all seen that do lifestyle medicine. And you know, if you think that all the doctors and nurses are out there with mops, and we're mopping and mopping and mopping, and we increase medical school enrollment, and there's more of us, and they hand us out bigger mops, and we mop faster, nobody knows how to turn off the tap. So one thing we don't do in medicine is root cause analysis. If we were great at doing root cause analysis like the business world does, then we would have stopped a long time ago and realized that nutrition was the answer. So I think we're finally there. London just had a Veggie Fest not too long ago in the fall, and it was their 3rd one. The first one 3 years ago had about 500 people, and everybody said, oh, here come the granola tree huggers. And this year they had 7,500 people spend $10 to come and educate themselves about plant-based eating. So we're definitely there. But this is what Monique Begin said. And so she said that health promotion was always the poor cousin living next door. This is CIHR data looking at the what's been spent in 40 years. And as we get sicker, the amount that we're spending on healthcare goes up on our GNP. And we're actually middle of the pack. We're about the same as most of the European countries. You don't want to see what the Americans are spending on healthcare right now. But they're coming very close to 18 and 19% of GNP and actually have some of the worst outcomes. But we only spend 2% on prevention during that time frame. And by prevention, that means they put money into public health. So there was no prevention, basically. Prevention is immunization programs. That's about it. We lead the world in diabetes. We look to our cousins south of the 49th parallel and think they're worse than we are, and yet we are leading the pack in the diabetes and pre-diabetes rates. So, you know, it really is, as we've all realized, it's a food disease. You know, the interesting thing is that the chronic disease accounted for 6% of global cause of death back in 2015, and it was estimated to be 73% by 2020. And then if you extrapolate that to 2030, we'll be knocking on 95%. Like, why are we still talking about creating more drugs and more procedures for a disease that's completely preventable?
That's right.
The WHO now says that it's the leading cause of death. It's poor food choices, and certainly by poor food choices I don't mean lack of food, I don't mean, you know, poor water sources, I mean, you know, the food choices that come with extra money and the ability to buy food. So I'm not going to go through all the evidence. You've heard a lot of the evidence already this morning. I'm going to go through these rather quickly because I want us to catch up on time a little bit. So you heard about the China study, you heard about the Adventist Health study, you heard about the Harvard Nurses study. And the Harvard Nurses study, I mean, there's a 91% concordance between the development of type 2 diabetes and lifestyle. And then the blue zones. Nobody talked about the blue zones yet today, but these are places where in the world where people routinely live to be over 100, and they have very common similarities amongst them. So again, China study, high correlation between animal-based protein, fat, and heart disease, diabetes, and cancer. And this is why, I don't know if any of you have recently seen, the Canadian Cancer Society finally came out with their discussion paper saying that if we all went to a plant-based diet, we'd see 40% less cancer rates. 40%. And that's all cancers. That's not just colon cancer and breast cancer and prostate cancer in men. The more you dig into the literature, you'll find that the things we're talking about today are cancer-causing agents. In fact, the WHO went out on a limb, nobody said it yet this morning, but in 2015, they labeled bacon a class 1 carcinogen in the same category as asbestos, benzene, and tobacco. So it's not do you get colon cancer, it's when you get colon cancer. And yet, the little town that we have a house in north of London called Lucan has an annual 3-day bacon fest. And they wrap and cook everything in bacon grease. And it's bacon, motorcycles, and rock and roll for the whole weekend. So yeah, if you want to see a bunch of unhealthy people or you want to park an ambulance outside, you'll be busy most of the weekend. The Harvard Health Nurse Study, and this is really similar to Canadian statistics because when we look around in Canadian populations, it's only 3.5% of us that are in the low risk group of having a low BMI, have a high cereal fiber and polyunsaturated fat, low trans fat, glycemic load diet, exercise 30 minutes a day, don't smoke. And they said at least half a drink of alcohol a day, and yet we know now that actually alcohol is not that good for us either. That's probably another big myth that we're getting rid of. And 91%, like I said, was attributable to the habits and behaviors that were not in the low risk group. The Adventist Health Study, this just continues to spin off papers all over the globe because they do really have a healthy lifestyle, but they've been followed by the American Cancer Society, the American Cardiology Society as well, and you can just see, you can read these, but they basically do better on just about everything, and those that don't, it's basically linked to the ones that go outside of what they that suggest and eat more animal products. And the 5 simple behaviors that really lead to health are those: not smoking, eating a plant-based diet, eating nuts several times a week, regular exercise, and keeping your BMI in those healthy numbers that everybody's been talking about this morning. A couple of years ago, this was Dr. Wareham being interviewed by Dan Buettner, the writer of the National Geographic article on blue zones. And Dr. Wareham was a cardiovascular surgeon who luckily practiced cardiovascular surgery as an assistant until his 96th birthday. This gentleman gets up every morning and goes swimming, has his oatmeal, and unfortunately just passed away a couple of years ago due to, I believe, pneumonia. I think I went online and read that he got a pretty severe pneumonia and passed away. But when he was interviewed at 101 at this conference, you can see how straight he stands. The guy was as brilliant as, just sharp as a tack. And had done primary cardiac surgery till his 75th birthday, and they wouldn't let him retire, so for another 21 years he was an assistant in the OR, a very respected assistant. In fact, some of his mentor, or the people he mentored, said that they couldn't operate nearly as well as he did. So in lifestyle medicine, it's quite different. The approach to care is very different, and I think some of the people you've heard spoke this morning practice this way. And I love this. This has recharged my batteries because, are there any family docs in the room? Yeah. Is anybody tired of chronic disease management? Okay, so, and it's not that we're tired of our patients. You know, our patients adore us, they love the extra steps that we take. Family medicine is rated one of the highest professions when it comes to consumer satisfaction. But the thing is that I'm going to tell you some new skills, and hopefully we'll help you develop new tools and attitudes in the upcoming months, because there's several of us working on webinars to show you how to do shared medical appointments. But I hope that this gives you, whets your appetite to do something a little bit differently, because the results are completely different. Okay, and like I said, this is real family medicine. And there's an old saying, patients don't care how much you know until they know how much you care. And when you go into a shared medical appointment where people drop their vulnerabilities at the door and start to share things with other people. And believe me, I'm in Sabo Beach where the population's 8,000 and everybody knows everybody. And it's a little bit harder to do shared medical appointments when people are checking out each other's grocery carts at the only grocery store in town, I might add. But the neat thing is the guy that's the grocery store owner is the chair of our board of directors. And so, just like you've had impact on your community, we've had impact on our community. And he shared a little known fact with me. He said they actually make more money on vegetables than they do on meat. And he said if they would let him get rid of the butcher shop and triple the size of the vegetable area, he'd be happy guy. Because Dave has lost 65 pounds and is now an ultra marathoner. Dave last weekend did an 80-kilometer trail run. And yeah, and so he's an amazing guy. Like he's become very supportive of our lifestyle ideas. So I'm going to show you two patients because I believe in just illustrative patients. So, and I'm showing you this first patient because I want to make a point about this guy. This is a guy I saw a couple years ago. This guy was running 40 kilometers a week. He was normal BMI, but he had a strong family history of heart disease. And so, you know, I saw his numbers and I go, you know what? I said, let's add Crestor. And so he was already eating fairly well, and I pushed him really towards more plant-based than he was. And you can see his HDL actually had a remarkable rise, because I think he wasn't getting the full bang for his buck with his nutrition and all his running. But basically, you know, I dropped his LDL by 60%. So this guy, you know, and he had no side effects from the Crestor whatsoever. I mean, this is a sniff of Crestor. So, you know, as much as I don't prescribe a lot of statins, and I'm going to show you another case after this where, you know, you can see what everybody's been talking about here, the power of a nutritional plan. So this is the next patient, and I've known this guy a lot longer, as you can see from the dates. And I show you these two numbers, or the big changes, because from about 2013 to 2016, this person went through a bit of a lifestyle change. And so, and you can see that, and I included his PSA because this is something he wanted done, and he stopped drinking dairy altogether. And his PSA dropped like a stone. And it was interesting that, you know, all his other numbers look like he's on a statin, okay? And this person took up running and changed his nutrition. It still wasn't plant-based at this time, but this was just with, you know, eating less processed foods and getting more active. But you can see that the person dropped 20% of their body mass, which is, as we know from the literature, is better than 2 or 3 or 4 pills. And in fact, you can teach an old doc new tricks, because that was me. Around the same time I did this, I decided to get rid of the little Friar Tuck hair thing and shave my head. And my patients were worried because they thought I was going through chemo. Because the weight came off so fast. And after my 15th half marathon, I said, no, it's not chemo, it's just health. I'm just healthy. I'm feeling healthy. And I said, and I don't need all this body hair. I mean, look at that big, fat German guy there. I mean, you know, and you know, when I was in high school and college, I was a shot put discus thrower. So I was one of those beast guys that would throw an instrument and scream. And we used to make fun of the runners. I'm one of 5 brothers. We all did the same thing. None of us were runners, and now 3 of us are long distance runners. So, and actually it was 6 of us, and my sister, my poor sister, with 5 brothers, but 3 of us are vegetarian now as well. So we've had 3 vegetarian Christmas get-togethers. No turkey, no cabbage rolls, no ham. And the nieces and the nephews love it. And in fact, nobody's falling asleep at 9 o'clock anymore, surprisingly, you know? So, so you can make some changes. And then I got started looking at some of Erica Frank's work out of UBC, and she's done a lot of work on healthy doctor, healthy patient. So, you know, it's no surprise that if you people in this room, if you look at your doctor and your doctor doesn't look healthy, you're never going to get the health talk from your doctor, right? You know, in fact, I would behoove you to try to, that's another one of those big words there, Shane. I would behoove you to encourage your family doc to reclaim their health. And in fact, I think family docs need some education from their patients about nutrition, and don't be afraid to push them along. So how do you do this in practice? And I've done this in solo practice. I've done it in a family health organization, a family health team. I'm now working in a system that's very much like a community health center. And I would suggest that you can even do this in a hospital-based practice, and certainly public health could do this. So this is the golden number, okay? And I want any of the family docs in the room to take a picture of this slide. This is probably the most underutilized fee code in the OHIP schedule of benefits. But for the chronic diseases of diabetes, congestive heart failure, asthma, COPD, hypercholesterolemia, and fibromyalgia, you can do shared medical appointments. And if you go into the schedule of benefits and you read about it, you can spend up to 3 hours with 12 patients and get paid extremely well for it. The number got cut off on the last one, but if I do a 2-hour shared medical appointment with 12 patients, I get paid $530. If I do 2 of those a day, that's the same as any other family doc in the system, putting in an 8-hour day, seeing patients at 15 minutes apart, and getting burnt out, right? And all of you have done that. And so you can bill $1,000 a day doing 4 hours of lifestyle medicine. Why isn't everybody doing this, right? Yeah, it doesn't, you know, and that was my aha moment. So I gave this talk at our national convention in Toronto, and people rushed up afterwards wondering, what do I do next? And I said, okay, here's where you can go to start to learn how to do this. And I've had 2 guys actually from Toronto want to come up to Sauble Beach and watch me do it. We just never, with the weather this winter, we just never connected, but we'll do it at some point. But a couple of them said that it really did sort of save their ideas about practice, because it is way more fun. It changes the boundaries. So and I use a Harvard model, so it took me about 4 months to get up to speed of how to do this really well. But when patients know that you're there and you're leading it, and we have a nurse that brings food every time we do it, so we get them to try new things. We now have patients bringing in binders that are bigger than anybody's got in this room, because they're now on the internet. They're clipping, they're sharing recipes. We have a lot of single seniors up in Sauble Beach, because there's lots of widows and widowers. And we have people getting together to make meals, which is something new. So there's a socialization part of this. People see each other in the grocery store and they go, you know, let me check and see if you got your daily dozen, because we use the Michael Greger. We've uploaded Michael Greger's. I use Michael Greger's website every single time, and so I've got a computer and a video screen and a room that holds 12 to 18 people, and we spend 2 hours together. And the average age of my group is 69 and a half. I've got 3 groups running now, and that's the group that they say do not change, and nobody has gained weight. In fact, the first 2 groups within 2 months had lost 48 kilograms in 2 months with 24 people. And so, and these are people living in Bruce County who hunt and fish and eat 3 eggs every day. And I was telling some of the group at dinner last night that there was a guy waiting in the lobby one day to talk to me, and I asked the staff, I said, well, he's a patient? And they said, no, he's an egg farmer. His sales are down. And he wanted to have it out with me in the lobby. And I said, I can show you how to grow kale. So anyway, you can have an impact on your community. There's no question. I have had people actually stop me in the grocery store and start lifting up all my vegetables looking for me. And I told them I'd have to drive back to Kincardine if I wanted to buy a burger. Like I'd literally have to go 100 kilometers because people know me up there now. The interesting thing, and I'm gonna stop with this. Oh yeah, sorry. Group medical appointments have been studied, and it was reported in the CMAJ as well. So highly acceptable, highly efficient. This group actually lowered A1C. And they said it should be widely spread. I mean, everybody should be doing it. This is the way we should be doing in family practice, especially with our chronic disease management. But the pharmacist she's not even a patient, and she wants to come to our clinic because she heard about, you know, helping her lose weight if she went plant-based. These are just some lifestyle resources I put up, and you've heard some of these already. And like I said, we will be revamping and talking about the Canadian, I think it'll be called the Association of Lifestyle Medicine, not the Academy. And then these are just some final thoughts. But, you know, the family docs that are in the audience, I think it could change, it'll change the way you practice, but more importantly, it'll change your own health and well-being. I think Emma, if she was in the office or up in the audience and stood up, she would probably tell you that I don't behave like a 66-year-old guy at the office. And certainly I feel like I've rolled the clock back at least 30 years. At least, in fact, maybe more. There's some days, I mean, there's days I ate because I've got arthritis too. But when you saw that picture of me, I was on 4 medications. I don't take a thing. In fact, I don't even bother with aspirin anymore because I weed so clean that I'm sure my endothelium is about as good as it can get. But you can fix your endothelium, and like David Jenkins said, TMAO is the culprit. You can fix one of the things that helps you fix your endothelium is things like kale. and things that are on that spectrum of medications. They are medications, foods. When I gave my talk at the National Convention, I actually had a poof in my jacket with a piece of kale. And I walked around all day with it, and everybody kept, hundreds of people would stop me and say, "You're a kale guy." And I said, "Well, I'm a nutrition guy." I said, "Kale's just part of it." But eat yourself healthy, and I think you'll feel better.